Hello and welcome back to Aging Well, monthly production by Somerville-Cambridge Elder Services. I'm your host, Nathan Lamb. With me today, I have two very knowledgeable guests, Corrine Lofchie and Jen Shaw. And we're going to talk today about things to do when you're 65 and health insurance. And you guys have a wealth of information on those topics, so I can't wait to get started on that. Before we start, would you guys like to introduce yourself?
Sure. So as you said, my name is Corrine Lofchie, and I work as an elder care advisor at Somerville-Cambridge Elder Services, and I'm also a SHINE counselor, and SHINE stands for Serving the Health Information Needs of Everyone. So we help people, especially with Medicare, but also with mass health and other health insurance issues. So and I work as well in the Aging Information Department, is called, where we provide information referral for a range of services and programs.
I love the Age Information Center. You guys do great work.
Thank you.
My name is Jen Shaw. I'm the HR director at Somerville-Cambridge Elder Services. The HR department assists with all employee needs, typically the entire employment life cycle from birth to death. So I've worked with employees as they're entering the agency and as they're exiting the agency. So I help with hiring, retirements, benefits information, and so on.
Excellent, excellent. So I guess a good place to start would maybe be talking a little bit about mass health. Explain for our audience a little bit about what mass health is and the difference between mass health and Medicare.
Okay, sure. Yeah, because I know that's something people get confused a lot about, the two, Medicare and Medicaid, or mass health, and trying to sort out the three and what they each are. So I'll start by saying that mass health and Medicaid are the same thing. It's just in Massachusetts, we call our Medicaid program mass health because we wanted our own name for it. Some states have their own name, but most just call it Medicaid. So once I had a teacher who explained it to me this way, and it stuck with me, that the difference between Medicare and Medicaid. Medicare, so care, we care for the elderly and disabled, and Medicaid, we aid the poor. And so I think that was the creators of the program kind of set it up that way. That was kind of the intentions behind it. So Medicaid is primarily based on income. There are other factors that apply in terms of being eligible, but it's mostly income-based. And Medicare is primarily based on your age and whether you have a disability. So for the most part, it's for people 65 and older, and who have a disability and are younger. And so that's kind of the big differences between them.
Absolutely.
Yeah.
And a lot of our programs that we offer at the agency are through Mass Health.
Yes, exactly. So Mass Health funds a lot of programs for people who need care at home. And so so Mass Health provides long-term care services, either in a nursing home or at home, which Medicare does not do.
Yeah. Absolutely. It's like, my understanding is it's a very complex system, and as if that wasn't enough, then they give them two names that are very similar.
Yes,
Just a
exactly.
little cherry on top. But you're an expert here, and I'm going to learn a lot today, which is really awesome. So if you have Mass Health, what should you know before you turn 65?
Yes, so this comes up a lot with clients we work with, because it's something that doesn't make sense to people, but is the reality that when you turn 65, the rules change in terms of who is eligible for Mass Health, and it gets more difficult. And people ask me, that makes no sense. Why should you be penalized for turning 65? And what I always say to people is, it doesn't make sense. It's unfortunately the system we've got. So the income limit goes down. So some people have had Mass Health like their whole life because they've been disabled, and then they turn 65, and now they're no longer eligible because their income is a little bit too high. The other big change is that when you're under 65, there is no asset limit, so they don't look at your savings. You can have a very large bank account or trust or things like that, but once you turn 65, they want to know about your assets, and you can only have $2,000, which is very little. That amount hasn't changed in, I think, over 20 years. So it doesn't really make sense, and there's been, efforts to change it and increase it, but unfortunately it hasn't gone anywhere. So that's the change that happens when you turn 65. So that's something people need to plan for, especially around the assets. There are certainly things you can do to protect your money or put it in ways that you could still be eligible. And so we don't get into that with people because we don't know at Elder Services the ins and outs. But if someone has assets, we recommend they meet with an elder law attorney who could advise them if there are things they might be able to do that then they could qualify for Mass Health.
Absolutely. So do you get a lot of calls from people who are about to turn 65 on Mass Health wanting to know?
Yes, we do. Usually, unfortunately, it's after the fact. So it's great if people, because unfortunately, Mass Health doesn't let people know ahead of time. And that's why this show, I think, is important to let people know, like if you can plan in advance, it's always better. It's better if you can do it in advance. Usually what happens is people lose their Mass Health because they're over 60, they just turned 65, and then they come to us, I lost my Mass Health, I don't know why, and they have lost a lot of things that are really important, like, they no longer can get certain types of healthcare services, so it's a real problem. So it would be really helpful if people knew in advance, but unfortunately, that's usually not the case. Yeah.
I think one thing that and I'm sorry.
No,
I
that's
think
great.
one thing it's always good to look at is you really need to talk to a financial planner and an attorney as early as possible,
Yes.
because the Medicaid and Medicare situation and Mass Health, it's so intertwined, and it is, and Corrine's absolutely true. The assets will absolutely ding you when you hit 65. And I think a lot of people, it's a shock to the system, and they're like, well, what do you mean? I have all this money saved, and this is the reason why I did this, and now you're telling me I'm not going to get the retirement benefits that I'd so thought I was going to get when I turned 65.
Right.
So although we're, I think, classically conditioned to do it when we're 65, I think it's always really good to start earlier, even when you're 30, when we're not thinking about these things. So we can start planning ahead and knowing what we can do with some of these assets so we can protect them moving forward. So you're not in a panic at 64 and a half going, what do I do now?
Yeah. Planning ahead is always a good thing, but most of us don't do that.
No, they don't. But the good news is that we have a service that people can call if they have questions, which you mentioned a little. Actually, if people call, they might end up talking to you about these things. Can you tell me a little bit about Shine and what you do?
Yes. So, so as part of our Aging Information Center, one of the things we do is health insurance counseling, and it's a free service where we can meet with anyone. There's no guidelines in terms of eligibility, so it's really open to anyone who is looking for assistance around Medicare and Mass Health planning. So we certainly encourage people, especially if you're around that age, to give us a call, and we can help you figure out whether you do need to talk to someone, who to talk to, and how to kind of do that planning. So, yeah.
And I know we're about to wrap up this segment, but one more question before we do. Let's talk about Medicare. Say you're 64. Any advice for people on what they should do when they're 64 and start thinking about their Medicare situation?
Yes. So, so this is another thing that comes up a lot, which is that unfortunately, now the retirement age is 66. It used to be 65. So when you're on Social Security, you automatically get put into Medicare. But if you're not yet on Social Security, you have to do it all yourself. So you have to enroll on your own, and so a lot of people don't realize that. So you need to enroll in Medicare through the Social Security office. So you can either do it online. Actually, you can go on the Social Security website, and you can. They say it takes about 10 minutes to enroll, so it's a quick process. But you do have to do that, or you can go to a Social Security office, and they recommend calling first to make an appointment, so you're not waiting there all day. Or you can also do it over the phone by calling Social Security. Again, you usually wait on hold for a while, but that's another option. And so you can enroll up to, you can start 3 months before the month of your birthday. You're turning 65. And that way it'll start the month that you turn 65. So if your birthday is like January 15th, if you enroll before January, your Medicare will start January 1st. If you wait longer, like if you enroll during the month of January, it'll start February 1st. It always starts like the next month. So.
And what do you get when you enroll in Medicare?
What do you get? So it's certainly not comprehensive health insurance. People often think that it is like, oh, great, I'll be all set. I'll have Medicare and I'm all set with my health insurance. So that's something that we often have to kind of explain to people and change their thinking about, because that's sometimes what people think. It's really, Medicare was set up to be kind of, to ensure that older adults aren't in a situation where they're going into like bankruptcy or debt because of medical issues. So it covers the big stuff, but it doesn't cover everything. So for example, for like all your outpatient medical care, for most all your outpatient, if you're going to the doctor or a specialist, your primary care, it covers about 80%. And then the other 20% you either pay out of pocket or get supplemental insurance for.
Yeah, Corrine brings up a really good point. I think a lot of retirees don't think about is that you have got the 80% that Medicare picks up, and then the 20%, otherwise known as the supplemental, the Medigap or the long-term care. A lot of people don't, budget in when they're thinking about retirement.
Yeah.
And current
Yes.
costs are saying that that's now $250,000. So long-term care is extremely expensive.
Oh, long-term care insurance, are you talking about?
Well,
No.
long-term costs
Oh,
for
like
like being in a nursing
home. Yes, yes.
And so a lot of people forget about that nugget, and they're like, okay, I've saved $1 million. I've been a responsible individual. I've saved my money. And then they forget, oh, I only have $800,000 actually, and $250,000 or $300,000 is actually going to go for medical expenses that I didn't plan or bargain for.
Yeah, potentially, right. That is potential.
So you actually bring up a really valid point, and those are things that we do, that I always try to remind retirees, because a lot of them, especially if your employer doesn't offer retiree health insurance, it's not in your post-retirement package. You have to think about those things beforehand.
Yes.
And there's several market options that you can go and look at.
Right, right. And they are, right, you have to put that in the budget, right? Because people think, like Medicare, they think their health insurance costs are going to go way down. And for most people, they do go down, but it's still substantial, because there's the different parts of Medicare, and it does kind of add up, yes, because you need a prescription drug coverage, and then if you buy a Medigap plan, they're called supplements that cover that 20%, those, that's an additional, and then you pay a premium for Medicare as well, for Part B, which is about between $100 and $140 right now. So, or more if you're higher per month, yeah. And then there's now additional, if you're higher income, there's a little bit more, you pay more. So, yeah.
Sounds like the two main takeaways are plan ahead and know who to call for help if you find yourself above your head a little bit in this. This has been a great segment. We're going to take a quick break, and we'll be back to talk more. Hello, and welcome back to Aging Well. We're continuing our discussion today on things to do when you're turning 65, which has had a lot to do with Medicare and Medicaid. I have two experts in the studio with me today, Corrine Lofchie and Jen Shaw. And yeah, let's get right back to it. So, understanding the rules of Medicare. So what happens if you don't enroll in Medicare? Because we were just talking about the different, like, you know, you need to do it here, you need to do it there. What happens if you don't?
Yes, and we see this a lot too, unfortunately, because people don't know that they need to. So, because no one's gonna call you up and let you know that you do. So, in most cases, you will have a penalty, and it's a substantial penalty that stays with you for the rest of your life. So that's why it's so important. So but there is one major exception to that, which is if you're working. If you're 65 or older, but you're still working and getting health insurance through your employer, you don't have to enroll in Medicare. So if that's the case, or your spouse is working and you're getting on their group health insurance, so you or your spouse. But if it's a retiree plan or COBRA or anything else that you're getting health insurance through, you still need to enroll in Medicare and pay that Part B premium. Otherwise, so the penalty is like a 10% per year that stays with you for life.
Yeah, no thanks.
You usually see a notice that comes out from your HR department if you're still 65 and working, and it says that you're on a Medicare qualified plan, and so that you have that. It's like and I had it in our benefits paperwork this year. So everybody had the form; it was ready to go, and then I can also send it out if it ever needs to be used by anybody at the age of 65.
So you get on a separate insurance plan that's like, so you're on Medicare and then you have.
No, I've had like employees, like the seniors who work with us,
Yes,
Corrine, I just send out the notice. We all do, it's just a blanket notice to all of us.
Yeah.
So if it was for me, it just basically says like, yes, this is qualified.
I see.
We're good to go.
So they don't have to get on Medicare while they're still working.
That's right.
Got it.
So your HR person should be able to tell you that.
Yes, that's correct. Usually most people who are hitting that 65 age period, they'll come down to you. They're like, I just got this notice. Yeah, I need to ask you these questions. Is that correct? You're like, yep. And then you just answer those questions.
Right. Okay. And then they can wait. And so then once they retire, though, Medicare gives you 8 months. So it's good. Like, it's not like you have to do it right away, but you have 8 months to enroll in Medicare without a penalty.
Good to know. And are there some surprises out there for Medicare coverage that people might not expect? A few items that may not be covered that you would think maybe would be?
Right. Yes, there are. We see this a lot. So again, because Medicare is was created a while ago, there are certain things that weren't part of it that they've been slowly adding on coverage, but there's still no coverage for things like routine vision and hearing care, as well as dental. There's really no dental. You can buy now. There are some products that you can purchase to kind of fill in those gaps, but if you just have Medicare, that's not covered, like eyeglasses, no dental at all.
Wow.
Yeah, dental is a big issue. We get that a lot as a problem for people. And then, like, a lot of people, again, think long-term care is covered by Medicare, like if they're, need to go to a nursing home long-term or need services at home. That's not, Medicare does not cover any of that. So that is the Medicaid, the Mass Health that we were talking about earlier.
Yeah. You know, to get long-term care, like you'll see like larger companies like Mass Mutual, they'll sell plans that people can buy that'll cover the
Yes.
long-term care. You can just go out into the marketplace and look for that. Certainly, you know, Corinne's absolutely right about the dental and the eyeglasses. If an employee approaches me, I always tell them as an HR person, if this is your last year of employment, I want you to go ahead and look into maxing out your FSA for that year. Get your glasses, get your dentures. Let's get the big purchases out of the way when it comes to that health insurance stuff.
Yeah.
I always tell them to do that because an FSA, which is pre-tax dollars, you can put into a pre-tax account your employer typically sets up for you is a good way to pay for those things before you retire. Always buy your big purchases before you retire.
Is there anything else that people should know about Medicare coverage? I know we've covered a fair amount of ground, but is there anything else they should know?
Not that I can think of. No. Nothing.
How about we'll go back to an HR question. Say you have a couple where a spouse is retiring and one is still working. What's the best way to approach that situation?
Well, both of us will answer this together. So typically when I've had employees who retire, one's still working and they have a spouse at home, I can't tell people this. I always tell them, please contact an attorney because it will impact Social Security draws. So contact an attorney because I always tell them you have to choose wisely. And I think it's like you have to do it joint. There's a way in which you choose it so it doesn't impact the employee that's still working.
For your Social Security, yes.
Yeah.
Yeah, Social Security, we that is a whole nother area.
That's another area.
Right, that we are not, I am not an expert on, and I always do advise people to talk to Social Security. That is very complex, like when to, decide to take your Social Security benefits. But in terms of the Medicare side of things, as long as Medicare is very individual. So unlike like health insurance through an employer, which is usually like you can get as a family or a couple, with Medicare, each individual can have a completely different kind of, Medicare supplement or program. Everyone does it individually. So, so one spouse could be on Medicare and one could just switch to their individual group plan through their employer. And that might, for a lot of people, that might be the best way to go, depending on the costs of each. They'd really have to balance, look at how much am I going to have to pay with Medicare, how much do I pay with my employer, depending on how good their employer benefits are, basically.
Yeah, I mean, this is really going to test like the budget of retirement because Corinne's absolutely right. When employees have a qualifying event like this, like one employee is going to retire, that employee is going to go on to Medicare, that person's premium is going to change, and I can get those people set up, and it's really simple. It's a very easy process. But again, it's going to change like retirement. It's going to change assets with Medicare and Social Security and like the entire retirement landscape. So again, contact a lawyer, contact a financial planner.
Start early.
Start early. Start when you're 30. Start when you're 20.
Absolutely. I guess the only other thing I'd ask, we're probably winding down, is anything else that you would want to add on this discussion of things to do when you're turning 65, Medicare or Medicaid? Anything you'd want to add on that? Or HR advice for people in those circumstances?
I know you brought up, Jen, about long-term care insurance. Just briefly,
Oh,
that's
God,
a whole
yes.
other
Please
topic.
do that.
But
yeah,
so that is something that I've read that around mid-60s for most people is like the latest time at which you could purchase it affordably. Which for most people, long-term care insurance is really not a viable option because it's so expensive. It's really for people, from what I've heard, we don't deal with it that much. It's for people who have like at least about 2 million. I forget what the upper limit is, like when you can self-fund your long-term care, but elite, like people who have 2 million or more in assets because of how expensive long-term care insurance is. So it's really for, fairly high asset people. But that's something people could look into. And in terms of like if you haven't done, planning around end-of-life care, power of attorney documents, those kind of things are good to do when you're earlier. They're good to do as young as possible, like we've been talking about, but it's something like if you're looking at all these issues at 65, you can kind of do it all then. And again, it's something where most people haven't done any of that kind of planning.
So from a retirement perspective, I do, if you feel safe enough in your organization to talk to your HR person anywhere between 6 months to a year before retirement, you should ask them, what are my options for benefits? If it's during open enrollment, that's when I'm going to strongly encourage you to max out your FSA. Get and max that out. And this year for 2017, it's $2,700 to max out that fund. Get your glasses, get your dentures, get it all done. Get your bridges. And then talk to your benefits person in your organization about your life insurance portability and if they have life and long-term options. Because there are sometimes supplemental programs that insurees and employees don't opt for during open enrollment that they can purchase before and they're portable after they leave. So find out what your options are, because most larger companies do have retiree health plans, and that's an option as well. But really start planning 6 months to a year. And if you don't feel comfortable, really hit the employee handbook hard and ask questions. And make sure you use up all your earned leave and cash that out.
I wish we had another half hour to go here. We have so much to cover. You guys have been really great today. And definitely start early. If you have questions, call our Aging Information Center.
Yes.
Thanks again so much. And thank you again for joining us. I'm Nathan Lamb for Aging Well. We'll see you next time.